So one of the reasons we have snoring is because the lower jaw falls back, and when the neck has a lot of fat tissue, the airway gets compressed, and that's when you hear the snoring sound. Now, there are two types of snorers. There are snorers who only make a lot of sound but do not have what's known as sleep apnea or oxygen deprivation. They're very vocal when they snore. These patients could get a dental intervention if they're disturbing their spouse or whatnot, but it's not mandatory for them. Then there's the next category. As snoring becomes more advanced, we develop into something called sleep apnea, where oxygen is actually being cut off in the night, and these patients usually have a very tired morning. They wake up groggy. These people have sleep apnea. So now, where does the dentist come into all of this? So this is what the simplest of snoring devices looks like. So there's the maxillary component and the mandibular component, and there's these little bands over here. This one is by a company called Ercodent, and there are different size bands. The shorter you go, the more you advance the mandible. So generally we get this to a position where the patient is comfortable. For the patients who have severe sleep apnea, and again, we know this only from a sleep study, they need to get a CPAP machine. They may not be sufficiently treated with a simple mandibular advancement device. They may need a CPAP machine, and that's when you tie up with your ENT colleagues and do a sleep study for these patients and decide what's best for them. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.